Good morning. I'm your host, Dr. Nick Laloy. Welcome back to PI Today's podcast. I'm here, and I can't believe to say it, in sunny Oakland, California. And as you can see, the Bay Bridge is right behind us. I'm on location, bringing you guys the best and brightest providers in California. Today, we are joined by Dr. David Suarez. Doc, thank you for being here, taking your time out of your busy schedule. Doc, tell us about yourself. Tell us about your specialty, your background, your training. Let's start there.
Absolutely. Well, thanks for having me,
Of
first
course.
of all. A little bit about me. So I am an interventional spine, sports, and regenerative medicine provider, and I work with Boomerang Healthcare here in the Bay Area at a few different locations in the East Bay. And my background, I did my undergrad at UCLA, did my medical school at UCSF here in San Francisco, my residency in PM&R at Stanford, and then I did a fellowship in interventional spine, sports, and regenerative medicine over in Napa with Dr. Boder. And I've been practicing for about now, I guess, 8 or 9 years, and for the last 5 years with Boomerang. And I do a lot of PI, work comp, a lot of musculoskeletal and spine care. And I would say PI has been kind of a revelation in my practice over the last several years, where it has become a part of what I really love about what I do for a lot of different reasons. So that brings me here with you today.
Wonderful. So PM&R, pain management. Some of the procedures you do are, of course, transforaminal injections, epidurals in the lumbar and in the low back, in the neck. There's also the sports aspect where, can you tell us more about that?
Absolutely. So yeah, you're correct, right? So there's the interventional spine part of it, which is treating a lot of spine issues, right? Whether it's discs, joints, etc., epidural injections, facet injections, and all of that. But I do a lot of musculoskeletal care as well. So any joint in the body, and from head to toe, right? Cervical facet joints in the neck, all the way through shoulders, hips, knees, ankles, wrists, elbows, and anytime there's any kind of pathology in any of those joints, whether it's tendon, muscle, cartilage, any injury that has occurred, whether traumatic or from degeneration, I'm able to evaluate that, diagnose it, and then treat it, whether it's with things like therapy or different types of injections, whether steroid or regenerative medicine. And I do all of that with ultrasound guidance when it comes to treatment and injections and stuff.
That's wonderful.
Yeah.
And you said regenerative medicine, and these days that's a very hot topic because the steroid therapy has been around for eons, right? So now in the new market, can you tell us what is regenerative medicine and what tools do you use for regenerative medicine?
Absolutely. So yeah, regenerative medicine, you're right. Yeah, it's definitely over the last 10, 20 years has become the hot topic, right? Dating back to Kobe Bryant going to Germany to get platelet-rich plasma treatments 15 years ago, and people trying to figure out, what is he doing in Germany? But essentially, it's using the body's own cells, and there are different types of cells that get used to get the body to heal itself, essentially, right? It's trying to get the body to use its own mechanisms that it possesses to fix the injury that has occurred. And probably the most common types of regenerative medicine out there, probably I'd break it down into 3 things. Platelet-rich plasma, or PRP, is probably the most well-known, I would say, out there.
And how's that done, extracted and done?
Absolutely. So platelets are one of the 3 types of cells in our blood, and just a simple blood draw can get a good concentration of platelets, and that gets centrifuged, so we can concentrate just the platelets and dilute it in just a little bit of plasma, and then that gets injected same day, right away, into the affected body part.
So it's from your own blood draw. That's what PRP is. Yes.
Yep.
Okay.
That's correct. Yep.
Right.
Yep. Just your own blood draw, and an hour later you're injecting it into the joint or the tendon or whatever it is that needs to be repaired. So that's platelets. Probably the most common and fairly simple to do, right? also very well known are stem cell treatments. And there are different types of stem cells, right? They're the ones that you get from your own body. So, for
Yes.
example, I do a lot of bone marrow stem cell treatments where I will get these stem cells from someone's iliac crest, the pelvic bone back here, and I extract the stem cells, and then again, centrifuging, etc. You concentrate just the cells, and then that's what you inject into shoulder, knee, or whatever it is that you need to inject the cells. There are other types of stem cells, right? Embryonic and amniotic fluid, all these other things that also have a good effect in the repair mechanism. But those obviously come not from you; they come from from other tissues.
From donors.
From
Yes.
donors,
Yes.
exactly. But they can also be obviously
Now,
very
which one is your preference? Is the umbilical, embryonic, or your own stem cells? What would you say you've seen the better outcome of?
Good question. And I'm a little bit biased because I do mostly bone marrow stem cell treatments. So I tend to do mostly from your own cells.
Yes.
So that's what I've seen.
That's the best results.
Works the best for me.
That's
my
actually
practice.
phenomenal.
Yeah.
Yes, that's actually
Yeah.
phenomenal.
Yeah.
And where are your practices located?
So I have 3 offices right now. I work in Oakland, in Concord, and in Walnut Creek.
Okay, Oakland, Concord, and Walnut Creek. And that's fantastic, Doc. And how many days are you available?
Oh, I'm 5 days a week.
5 days, 5 days a week.
Yeah,
Hardworking
absolutely.
doctor.
Yes. I'm always available. Yes, and always happy to treat patients and get people's pain to go away and hopefully get them back to their usual level of function. So.
And we thank you so much because we know that in certain areas, access to good doctors and good clinics are limited. In some places in Northern California. So we thank you for everything you do, and thank you so much for being on the show.
Absolutely. Thanks for having me. And I'll mention one more thing is that actually I'm a native Spanish speaker too. So I actually
you're fluent.
I am.
That's right. You're Colombian.
That's right. I'm Colombian.
That's
I was
right.
born and raised in Colombia. I didn't mention that at the beginning, but I actually have a fairly large Spanish-speaking population because I get to treat my patients in their own native language, which goes a long way, right?
That is huge. And natives from Colombia, which is very rare. And we're very happy that you take care of our lives in the PI industry, and hopefully you'll be around for a very long time taking care of patients.
Absolutely.
Doc, thank you very much for coming.
Hey, thanks
Take
for
care.
having me.
All right, guys. I'll see you next time on PI Today. It's podcast.